Phoneris inner cannula and Aeroflex ventilator circuit connector provide a unique design for connecting trach patients to ventilators. The system offers significant improvements to help decrease the likelihood of ventilator disconnections. The Phoneris inner cannula has longer thumb tabs that help in two ways. First, when the inner cannula is placed, you not only hear a click as it locks in place, but the larger tabs make it easy to confirm that it's secure. When removing the inner cannula, the larger tabs also make it easy to press and remove. Then, when connecting the Phoneris inner cannula to the ventilator, the Aeroflex ventilator circuit connector provides additional enhancements to lessen the chance of disconnect. Again, you'll hear a click sound as the connection is made. The positive click jaws hold tight to help prevent disconnect and release easily with a twist. In addition, the connector offers 360-degree swivel for better movement and less torsion on the inner cannula. This means that if the ventilator circuit is moved or twisted, the connector will twist along with it, also minimizing the likelihood of disconnect. Smaller corrugations, tapered inner walls, and a flush fit with the cannula let inline suction catheters pass through the connector with ease and comfort. These innovative features on the Phoneris inner cannula and Aeroflex ventilator circuit connector combine to help reduce the risk of ventilator disconnections.